supplementaries. Question number 12, Paul Foster-Bell.
Mr Speaker, my question is to the Minister of Health and asks, what progress has been made on providing better access to surgical first specialist assessments?
Mr Speaker.
Honourable Tony Ryle.
Mr Speaker, I'm pleased to advise that the number of New Zealanders getting assessed by hospital specialists to see if they need elective surgery has risen by 40,000 under this government to a record 294,000 assessments. This is a 16% increase under this government, an average increase of 8,000 a year. This stands in stark contrast to the period between 2001 and 2007-8, where the number of people who were able to access surgical specialist appointment basically flatlined.
Point of order, Right Honourable Winston Peters.
Speaker, you heard the last part of that answer. Where was that in the primary question sought by the questioner? And why did you allow him to finish that way?
Order. The member's got a perfect right to answer the question as he sees fit. There was nothing out of order with the answer from the Minister. Supplementary question, Paul Foster-Bell.
Supplementary to the Minister, what advice has he received on the benefits for patients of this significant increase in first specialist assessments?
Honourable Tony Ryle.
Mr Speaker, surgical specialist assessments are the gateway to elective surgery, which can relieve pain and restore quality of life. As an example, the number of patients who have received an orthopaedic first specialist assessment now sees 20% more patients, or nearly 10,000 more orthopaedic assessments being delivered each year than compared to 2008 under the Labour New Zealand First government. This is a great credit.
Point of order, Right Honourable.
Speaker, there he goes again. And second,
Order. Would the member just give his point of order?
Well, I am.
Well, do it.
If you don't mind, I've just got a few words out.
Order. Member will resume his seat. The member has raised a number of points of order that have not been valid today. I give the opportunity for the member to stand again and raise a point of order, but without the introduction.
Mr Speaker, my point of order is that the Minister has repeated the same offence that I complained about, and that is that he is now talking about, for example, a New Zealand First Labour government. There never was one. That was a misinformation for a start. It's not part of the question being asked by the supplementary question in the first place, and that's the point of order I seek to raise, and I have a right to raise it in this House.
The member has a right to raise a point of order, and on this occasion he's raised it. I have ruled that I did not think the answer was out of order. I'd already done that, so the member is effectively questioning my ruling, and I will not continue to take it from the member.
Mr Speaker, an example is the number of patients who've received an orthopaedic first specialist assessment is now 20% more, or nearly 10,000 more orthopaedic assessments have been delivered each year than in 2008. This is... Who was in government then?
Order. That's not...
This is a great credit to the hard-working staff involved, and I want to thank them for their effort in providing even better services for New Zealand patients.
Order. I have received a letter from Honourable Clayton Cosgrove seeking to debate under Standing Order 386 the government's announcement about details of the float of